The Pittsburgh Marathon is almost here, and whether you're running the full race or just enthusiastically cheering from the sidelines, that would be me. Taking care of your body is key.
Joining us today is Dr. Zach Shasteen, a chiropractic doctor who knows all about keeping athletes in tip-top shape. Now, Dr. Zach, I don't necessarily consider myself an athlete, and I say, if you see me running, you should probably run too, because I'm being chased.
There's a reason. There's a reason for it.
But there are some real key tips, chiropractic tips, obviously, to keep us all limber, even if we are at the finish line.
Yes. So main thing is preparation before the race, getting adjustments weeks, days before, then also after the race, the 26.2 miles, which is a real toll on our spine and our joints, to get adjusted after, but also using implements such as stretching, foam rolling, heat therapy, cold therapy, things like that.
I always get confused about the heat and the cold and when to use what, because I'm more of a heat kind of gal.
I like a pad.
I always want the heat, but sometimes you do need to ice things.
Yes. Post kind of treatment soreness from running the marathon, 24, 48 hours, I like ice. Anything more chronic after 48 hours, heat's typically better. We want to send blood flow to the region, flush out inflammation.
I see. Okay.
And I mean, in the warmer weather, everyone's being more active. So what are some stretches that can really get us limber?
Yes, so some stretches here. We can move through here a little bit, okay? So we want to do more of dynamic. So we're going to focus on the hammies first. A little bit of walk in place, scooping down this way.
I'm going to have you do that. This may not allow me to.
I know. I will gladly.
A little bit more walking, left leg, scooping through that way. You feel that deep stretch there in the hamstrings?
I do. I'm actually feeling muscle stretch that I don't think have been used in a while.
Yes. And then another main important one, especially with us runners and marathon runners, is our calves. A little bit of just stepping up on your toes, feeling a stretch in the gastrocnemius and soleus, which is our calf muscles.
Well, we do this almost every day in heels.
Yes, I was going to say that's
perfect. This is just, we have Barbie feet
That's
over
an
here.
athletic movement to begin with, is to walk in heels. So.
Yeah, that's right.
Oh my God, it is.
You said us. Does this mean you're running? Are you running in the marathon?
No. I have about 30 to 40 patients right now I'm treating, getting them ready for the marathon this weekend. My collegiate tracker, I'm retired, so I'm going to take a break from running for a little bit.
Good for you.
I don't blame you. What are some of the most common injuries that you see either in training or day of race that we need to be prepared for?
Yes, most definitely. A big common one, we have probably all heard of it, plantar fasciitis. Okay, that is when the bottom of our foot, the tissue there gets a little bit inflamed. Properly treating that would be foam rolling, chiropractic adjustments, ice therapy, heat therapy, again, very common, but also just joint pain, hips, knees, ankles, lower back. That's why the adjustments are foundation to marathon runners.
Okay.
Absolutely. And talk to me about the shoes, because I am always in the market for the cutest ones, and that is not always the most supportive. So if someone wants to go on a run for 26 miles, which is crazy, but good for you, or just like a leisurely run throughout the park, your shoes are most important.
Yes, shoes are the foundation. Our feet are the foundation of our body because it supports everything coming up. Many different brands out there, Brooks, Hoka's, On Clouds, Nikes, Adidas, I like them all. Everybody's foot is different, kind of like a footprint, so it's very unique. So I like to kind of do it trial by error.
Okay.
Try different ones. Also, shoe orthotics. Shoe inserts is a big topic nowadays. Getting a custom pair fit for your right and left foot is super important, especially when you're putting miles on your feet. So.
I made the mistake once doing the half or a relay. I don't remember which one it was, and I bought shoes at the big when you come at the race expo to come get your stuff. They sell shoes. Do not wear the shoes that you buy at the expo to the actual marathon. Break them in first. That's my advice.
We are noting that.
You mentioned the spine and the back. Obviously, I think when we think chiropractic care, we think a lot about the adjustments in our back.
Yes.
But you're putting a lot of pressure down here. Do you think, important to see a chiropractor immediately before and immediately after? How much time should we be spacing out?
Yeah, so definitely a very good question. Big important thing is to definitely be seeing them right before and right after to help with any inflammation, misalignments of the body. I mean, it's a lot of
nerves
pinched
too,
nerves.
like all of that can happen.
Yeah, sometimes you get numbness tingling down the legs, the arms, sciatica, lots of injuries when it comes to running. So it's very important to see a chiropractor on a routine basis, just not when you're running a marathon, but also after the marathon.
Got it.
You just listed every pregnancy symptom.
I know.
I was like, wait, am I a runner? Do I have runner's bod?
Yeah, exactly.
Not really.
Thank you so very much. So great to meet you. And if you would like to learn more about Resilient Chiropractor Services, we will link you up on our website at kdka.com/talkpittsburgh.